There are approximately 2 million women veterans living across America, and many of them are in their childbearing years. Providing the highest quality maternal health care and support to veteran parents is critical to VA's mission. This video provides information that can help you provide them with the care they deserve. Women veterans are strong and resilient. However, their sacrifices have come with a cost. Many women veterans now face challenges like musculoskeletal injuries, mental health issues, military sexual trauma, and post-deployment adjustment issues. Because of some of the characteristics of the women veteran population, they may face health challenges during and after pregnancy. VA's primary care teams provide comprehensive primary care for women all in one place, including care for acute and chronic illness, gender-specific primary care, preventive services, and mental health services coordination of care. VA is committed to serving women veterans and helping community providers like you understand the services VA covers for veterans. VA and its providers can also be a valuable part of your coordinated care team. Together, we can create comprehensive, seamless care for women veterans. This video shares information about VA's fertility and reproductive health, pre-pregnancy health, mental health services, and maternity benefits. Women veterans may not be aware of the services that VA offers or the benefits available to them. If they find their way to you for maternity-related healthcare, it is important that you are aware of the benefits and services available through VA so you can ensure they receive the best care possible. VA's Women Veterans Call Center accepts calls or texts to 855-829-6636 to help you or women veterans navigate VA and provide connections to benefits and services. To get the highest quality care, women veterans need clinicians who are attuned to veteran women's health needs. For more information about how military service impacts women veterans' medical care needs and how to provide the patient-centered, gender-specific care they need, the 1-hour free CME Caring for Women Veterans is available at vha.train.org. Fertility services and reproductive health. Military service can affect the reproductive health and fertility of veterans. In the veteran population, delayed childbearing due to military commitments, PTSD, and pelvic floor disorders are common. Our providers collaborate with veterans to achieve their best health and help them meet their reproductive health goals. Veterans who are having challenges building their families can turn to VA for a wide range of fertility evaluations and treatments, such as genetic counseling and testing if needed, intrauterine insemination, and sperm retrieval. Veterans with a service-connected disability that results in infertility may be eligible for further benefits such as in vitro fertilization, assisted reproductive technology, or limited reimbursement for adoption. Strict eligibility criteria must be met for the veteran to be eligible for their spouse to receive services for IVF, ART, and adoption benefits. Learn more about VA's reproductive health and fertility services on VA's Health Training Network at vha.train.org. Pre-pregnancy health. You and VA primary care providers know that a healthy pregnancy begins before conception, and it's never too early to encourage veterans to take healthy steps if they are thinking of becoming pregnant. As you know, prenatal vitamins, regular activity, good nutrition, and avoidance of tobacco, alcohol, and illicit drugs are important pre-pregnancy behaviors and actions. VA provides tobacco cessation support, management of substance use disorders, and weight loss and nutrition support to veterans. VA also offers prescription medications, such as prenatal vitamins for veterans. In fact, VA is one of the few healthcare systems in the country using integrated technology to track prescriptions for medications that may be harmful before or during pregnancy or lactation. VA also knows that pre-pregnancy health goes beyond physical health. VA supports veterans with critical services related to mental health care, substance disorders, intimate partner violence, and social service needs such as housing and hunger. In addition to reproductive and maternal health, VA is committed to supporting the whole health of women veterans. VA provides a wide variety of other services such as acupuncture, yoga and tai chi, chiropractic care and physical therapy, nutrition and weight management coaching, mindfulness coaching, and sleep therapies. For more information about available VA support for veteran pre-pregnancy health, see VA's maternity care benefits brochure at womenshealth.va.gov. Maternity benefits. VA provides care coordination and maternity care as a health benefit to veterans, but maternity care services are referred to community providers like you. Care from certified nurse midwives and deliveries at accredited birthing centers are covered under the VA maternity care benefit. Every pregnant veteran has a maternity care coordinator, MCC, who can work with you and the veteran throughout their pregnancy journey. The MCC will make sure all the necessary steps are taken to provide maternity care to veterans. This includes making sure VA records are kept up to date and that vital health information that may affect maternity care is shared with you. It is important that you and veterans understand that all pregnancy care is covered by VA. This includes prenatal care, labor and delivery services, lactation education and support, lactation supplies such as bras and breast pumps, childbirth preparation classes, parenting classes, pregnancy-related physical therapy, mental health evaluation and treatment, pregnancy options counseling to include abortion, if indicated, and abortion services when needed to preserve the life or health of the pregnant person, or in cases of pregnancies that are the result of rape or incest. VA also covers the cost of newborn care provided by community providers like you, which starts with the day of delivery and carries into the first days of life. The MCC working with the veteran can explain the newborn care covered by VA. The specialty care you provide, along with the services and benefits VA offers, can ensure that every veteran receives the best possible maternity care. To learn more about VA's maternity benefits, visit vha.train.org or womenshealth.va.gov/topics/maternity-care/index.asp. Mental health services. Veterans' mental health is an important part of their overall health, especially during pre-pregnancy, maternity, and postpartum periods. We know that some veterans may have mental health conditions related to their service. Others may have experienced trauma that may affect their reactions to pregnancy, labor, lactation, and parenting. VA is ready to work with you to provide mental health care for women veterans who are trying to conceive, expecting, or who are new parents. Women veterans can continue to receive their mental health care at VA during their pregnancies. VA also has trained mental health providers who understand the unique ways mental and physical health issues such as depression, anxiety, PTSD, and substance use affect women veterans. They are also trained to address perinatal loss and postpartum depression. MCCs can work with you to manage veteran care for any needed mental health services. For more information about maternity-related mental health services, visit vha.train.org or womenshealth.va.gov/topics/maternity-care/index.asp. You work hard to care for all your patients, and VA is your partner for your veteran patients. We're here to work with you to answer questions about the benefits and services available for veterans who need fertility and maternity care. Our goal is to ensure women veterans get the benefits and services they have earned and receive the best care within VA or in your office. Working together, we can ensure women veterans receive coordinated, seamless fertility and maternity care to support their best reproductive health. To learn more about providing care to veterans or joining the VA Community Care Network, visit va.gov/communitycare/providers/index.asp. For more information, visit vha.train.org.